skin is a picture of kind of what's going on in the system. If your body's short of essential fatty acids, your face is going to show it. Okay, your skin's going to show it. If you're thyroid deficient, your skin's going to show it, and it's going to be dry. It's going to be, people talk about the T-zone and everything, and you know, and they directly apply stuff to this zone. Well, it's just the most, for them, it's the weakest area of the skin. For them, it's the target area that, as things are coming out and are being affected, it's the most vulnerable area. It's like saying, you know, a headache. Well, okay, this medication is specifically for headache pain compared to this one for knee pain. It's the same thing. I mean, it's the same treatment. It's just, this isn't the problem. What's going on, and here's the problem. So if we can fix the thyroid, and some people are sitting out there saying, well, my thyroid's fine, the doctor checked my thyroid. Your thyroid may not be fine. The lab tests very often lie. And even though your blood tests say, I'm fine, everything's in normal range, you really could have low thyroid. And you just have to go and look at online and see, do my symptoms match up. Dry skin is one of those. We can treat tons of different things, but you know, people who have low thyroid generally go through lotion like water. I mean, they sit there and they, you know, after the shower they put lotion on. Later in the day, put lotion on. You know, during the day, put lotion on. I mean, it's just, they're going through, you know, the big container in a week or two. You know, so you know, the system just sucks it up from the inside out. Like I said before, the omega-3s and sometimes omega-6s, but like flaxseed oil and fish oil tend to be very effective at kind of emolliating the skin, making it oily, making it have not be so dry from the inside out. The problem with lotion is on the surface we've got, this is all dry, this is all dead skin on the surface. All right, so we've got all this dead skin here. And if you put lotion on, it's got to you're moisturizing dead skin, and then it gradually gets through to some of the next layers, but it doesn't get really deep. So as soon as those dead skin go off and the next layer comes up, now the system's, it's dry again. Because, you know, all that oil that you put on is gone. It's been flaked off. It's through. So. Well, eczema, one of the core issues, I believe, is that eczema is an inflammatory condition within the body, usually to a food allergy, but occasionally to yeast, an overgrowth of yeast in the intestines or somewhere in the system, and it is producing this inflammatory reaction, and inflammation is trying to come up through the skin somewhere. So you get these patches of bright red skin that crack and that are itchy and that are irritable, and it's so funny because I have parents that come in with their kids and they bring these creams, Eucerin, these hypoallergenic creams that the doctor recommends, and that are, you know, $40 for a, you know, 8-ounce size tube, and you know, I'm like, that's insane. And yet they go, well, this is the one that's supposed to help. Is it helping? Not really. In fact, I think this one makes it worse. And most of the time when I'm going through my testing, I find those Eucerins and some of these other medical creams that are out there tend to be the worst ones out there. So, you know, and then we talk about the cortisone creams. The cortisone creams, again, deals with things from a topical level. Cortisone is hydrocortisone or cortisone oral. It's cortisol, it's prednisone. It's all in the same family as steroids. It's an adrenal steroid. And you're putting it on top on a certain percentage, usually 5% solution, to decrease the inflammation. Again, the problem is if the inflammation is coming from underneath and you're waiting until it comes up to the top and you're cleaning it up. And so there's never going to be an end to this unless the person resolves it on their own. So the idea behind this is, well, what's this coming from? And we had a girl in here a long time ago that was just the cutest little girl, and she was covered head to toe in eczema. Her face was flaking, and we treated her for food allergies. We figured out what the food allergies were, dealt with the food allergies, and you know, I didn't see her after the first, I think, 3 visits, but I heard from someone that she referred in. They're like, oh, she's like perfect skin now, and everything's gone, and you know, it's like, and it's all just a matter of figuring out like, again, what's the core issue? What's at the base of this? What's causing the inflammation? And then just, if it's a food, stop eating it. If it's a airborne thing, obviously that's a whole other thing. But usually airborne things don't cause eczema. You can get topical hives, you can get other things, but they aren't going to cause eczema. Yeast, on the other hand, can. And yeast sometimes it can be hard to control, but not impossible. And we send herbs in there, we deal with decreasing the sugar in the diet, and we bring in some healthy bacteria, and usually that takes care of it. That's correct. I'm a firm believer that everything comes from the inside out. Outside of having a abrasion or scratch or something that happens from an external trauma, obviously that's from the outside. But when you also just get this inflammation on your arm, there's no reason why the external environment should be resulted. I mean, and the bacteria on our skin should be harmless. It shouldn't. People get concerned, and we shower and we try and get all the stuff clean, get ourselves cleaned off of all the stuff that's on it, the antibacterial soaps and everything. Well, really, our skin is designed to have an oil on the surface. That's part of the barrier, and it's supposed to have some bacteria, normal bacteria, just sitting on the surface. That's what it's there for. And so it's only a problem when we cut through the skin, and now the blood and the skin have a bacteria that wants to get in, but that's why we bleed out. The blood flows to kind of flush that out. Just like in a cold, the nose runs to try and wash out the virus or the allergen out of the nose to try and clean it off. So to me, everything comes from within. And we can deal with it topically. I have no problem dealing with it topically, but you just have to understand that you're not solving any problem. It's kind of like taking a Tylenol for your headache. You're not getting a headache from because you have a deficiency of Tylenol. As soon as Tylenol wears out and the core problem, the headache continues, you're going to have a headache again. You need to take another Tylenol. Same thing happens with the skin. So I just want to thank you for joining us today. And just again, my name is Michael Berglund. I am a natural doctor dealing in a variety of different family, pediatric, and adult internal disorder kind of problems. And keep tuning in. We're going to try and produce more of these, and we look forward to your feedback. Feel free to comment on the YouTube spot below, and let me know what you think. And if you like these, you can subscribe to them, and look forward to seeing you again. Thank you.